I'd like to call the Board of Commissioners August 2nd meeting to order. First order of business is the invocation by our County Manager, Ms. Sharon Russell.
Good morning, Chairman Bryson, Commissioners. Let us pray. Dear Heavenly Father, we thank you for this opportunity to come before you and conduct the business of Onslow County. Please be with those who are defending our nation and with all of our first responders. May all we do this day bring you honor and glory. Now, with deep respect and reverence for the faiths, beliefs, and traditions of those gathered here, join me in a moment of silence. Amen.
Our pledge by Assistant County Manager, Ms. Sherry Slater.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I want to welcome everybody that's come to be here today. I'd like to recognize elected officials, Sheriff Miller, for being in our company today. Thank you, Sheriff. Also, North Topsail Beach Town Alderman Susan Meyer. I think she's here. Thank you for being here. Also, we have Colonel Thomas from the Onslow County Sheriff's Office. Thank you, Colonel. And Dr. Barry Collins, our Superintendent of Onslow County Schools. Thank you, sir. We ask all in attendance to please set your cell phone to silent or vibrate mode. The board offers the public one opportunity to speak during the meeting. Comments should be limited to no more than 5 minutes and may be on any issue upon which the Board of Commissioners has control. In accordance with the board's adopted rules of procedure, commissioners shall reserve responses, if any, for the commissioner's comment period on the agenda, which is at the end of the meeting. With no other items being considered separately, a motion to adopt the meeting agenda is in order. Do I hear a motion?
Second.
Motion and a second. Any discussion? All in favor of the motion signify by saying aye.
Aye.
All opposed, motion carries. Is there any item on the consent agenda that any board member would like to have removed for discussion later at the end of the meeting? Hearing none, I entertain a motion to adopt the consent agenda.
Motion. Second.
I have a motion and a second. All in favor of the motion signify by saying aye.
Aye.
All opposed, motion carries. Thank you. We are now at item number 3, which is public comment section. Ms. Russell, do we have anyone signed up?
Thank you, Mr. Chairman. We do. We have one speaker signed up this morning for our public comment period. I would remind citizens that they have this opportunity to address the board as a whole for no more than 5 minutes per comment on any issue upon which the board has control. We do ask speakers to not have conversation with anyone in the audience, to not yield their time, and to make sure their language is professional at all times. At this time, I would like to call forward our one speaker for her 5 minutes, Ms. Salem Clark of 121 Canal Street. And if Salem, if you could give us your name and your address as you begin your remarks.
Good morning. My name is Salem Clark, 121 Canal Street, and I am the Onslow County Tourism Manager. And this morning, I am coming to you because our new visitor guides are in, and I wanted to present those to you. We're very excited about them. We have worked with Jacksonville TDA to put these together. And as you can see, they're very bright and colorful. These are actually being distributed to our 12 welcome centers throughout the state. Plus, we'll also be sending them out to other visitors and welcome centers throughout the state or anyone that requests them. So we have printed 25,000 of them. They should last for about 2 years, and we're really excited about them. We put a lot of hard work into them. They have maps and all the great things to do in Onslow County. And I just want to say thank you so much for y'all's support of Onslow County tourism and everything that we do. So again, I hope you enjoy the visitor guides. Thanks.
Thank you.
That concludes our public comment period, Chairman.
Okay, we'll move on to item 4, which is surplus land. Is Ms. Jones here, or is somebody going to present that for
I was
us?
going to present it for
Okay.
Mr. Chairman and Commissioners. The county received an offer for a citizen
or from a citizen in the amount of $6,500 to purchase land located at 115 Annie Avenue, parcel number 012239. It's approximately 0.17 acres in size. The county goes through the negotiated offer, advertisement, and upset bid process. And if approved, it will be set out for bid. So for 10 days, people can upset that bid. If no other upset bids are received, then the property will be sold upon tendering of the $6,500. So it's respectfully requested that the Board of Commissioners approve Resolution 21-017, which authorizes the purchasing director to conduct the sale of the property using negotiated offer, advertisement, and upset bid process, and to authorize the chairman to sign on behalf of the county.
Motion to approve. Second.
We have a motion and a second. Any discussion? Hearing none, all in favor of the motion signify by saying aye.
Aye.
All opposed, motion carries unanimously. We'll move on now to Section B, Annual Settlement of Tax Collector Preliminary Report and Sworn Statement. Mr. Harry Smith will present this and several other items.
Good morning, Mr. Chairman, Mr. Vice Chairman, and Commissioners. Following the close of the fiscal year each year, North Carolina General Statute 105-373 requires that the tax collector provide an annual settlement to the Board of Commissioners. This involves several steps. The first one is found in item B, which is the first part of the process. The collector is to provide the board a preliminary report showing the list of owners with unpaid taxes on real property, as well as a list of owners with unpaid taxes on personal property. The collector is also to provide a sworn statement certifying that the diligent efforts have been made to collect the outstanding balance of the taxes due. And on your agenda, you can see that the first list of real property contains 1,373 accounts with a tax balance of $799,312.29 of unpaid 2020 taxes. And the personal property list contains 4,939 names with a balance due of $286,337.76. I would like to mention that due to the diligent efforts of our collection staff, as well as the support of this board and county administration, we were able to achieve the second highest collection percentage on record in Onslow County at 98.85% for the fiscal year ending 2021 as of June 30th of this past year. With that, it is respectfully requested that the Board of Commissioners accept the preliminary report with the sworn statement included therein and the list of owners with unpaid taxes on real and personal property.
Motion?
Motion to approve.
Second.
Motion and a second to approve the preliminary report. Any discussion? Hearing none, all in favor of the motion signify by saying aye.
Aye.
All opposed, motion carries unanimously. Item C, I think that's yours also, sir.
Yes, sir. This is the next step as far as the annual settlement process, which is the settlement for current year taxes for 2020. The settlement for current year taxes under 105-373A3 states that after July 1st and before being charged with taxes for the current fiscal year, the tax collector shall make full settlement with the governing body of the taxing unit for all taxes in his hands for collection for the preceding fiscal year. And the total balance was around $1,085,000, which is basically the sum of those real and personal property lists that are still remaining 2020 taxes. It's respectfully requested that the Board of Commissioners approve the settlement for current year taxes for 2020 per statute 105-373A3.
Motion?
Motion to approve.
Second.
Have a motion and a second. Any questions for Mr. Smith on this? Hearing none, or any comments? Hearing none, all in favor of the motion signify by saying aye.
Aye.
All opposed? Hearing none, the motion carries unanimously. Section D, Annual Settlement for prior year's taxes.
Okay, the next topic is our settlement for prior year taxes under the 105-373 paragraph B provides that the collector present a settlement with the governing body for taxing unit for collections made on the prior year's taxes, and this would have been, since 2020 was our most recent fiscal year, it would have been the 10 years prior to 2020. The taxes for the prior year's remaining balance is $3,343,377.53, and these are to be charged back to the collector, and I misstated that. That does include the 2020 taxes also. It's about 2.25 million, and prior to 2020, with the 1,085,000 brings it to the 3.33. And it's respectful request that the Board of Commissioners approve the settlement for prior year taxes under 105-373, paragraph B.
Motion for Section D.
Motion to approve.
Second.
A motion and a second. Any discussion? Hearing none. All in favor of the motion signify by saying aye.
Aye.
All opposed, motion carries unanimously. Thank you. Section E.
Okay, Section E is the order of collection for the tax collector, and this goes over to General Statute 105-321, which stipulates that the Board of Commissioners approve an order of collection which authorizes and empowers the tax collector to utilize all available statutory remedies in collecting delinquent taxes. The order of collection has the force and effect of a judgment and execution against the taxpayer's real and personal property. The order includes 2021 taxes, which will become due on September 1st, as well as the prior year's taxes referenced in the settlement. So basically, this is what actually gives us the authority to go out and do the bank attachments, garnishments, foreclosures, those types of statutory remedies. And in addition to those, we also do debt set-off. We submit debts to the North Carolina Debt Set-Off Program, and our staff has recently been going through the NC Cash Program, which is funds that are being just held by the Treasurer's Department and looking up funds that are available that people haven't claimed. It's like unclaimed property, and we can actually make a garnishment towards those also. So we're in the process of adding that to our repertoire this year, so to speak. So having said that, the specific action requested is that the Board of Commissioners approve the order of collection and authorize the chairman to sign the order of collection pursuant to 105-321 of the North Carolina General Statutes.
Motion to approve.
Second.
Motion, do I hear a second?
Second.
Do we have a ballpark figure on the number of partials that, right offhand? If not, that's okay, but a ballpark figure of the people that has not paid the number of partials that's owed?
I don't have it right offhand, but I'll be more than happy to get it for you.
Okay. Any further? All in favor of the motion signify by saying aye.
Aye.
All opposed, motion carries. Thank you, sir.
Thank you.
Section F, that's Ms. Galloway.
Good morning, Chairman, Vice Chairman, and Commissioners. Today I'm here to talk to you about our renewal for the administration of our Blue Cross agreement and our stop-loss insurance. Onslow County provides health insurance to our eligible employees by partnering with Blue Cross Blue Shield of North Carolina, and they're our third-party administrator because we're self-insured. As a self-funded plan, Blue Cross provides claims administration for our medical and our pharmacy services, and they also provide our stop-loss insurance as well. Every year, the county reviews this renewal agreement with Blue Cross, and we're pleased to report to you that this year there are no changes in the administration fees. The document before you for your consideration is effective this fiscal year 21-22, and it reflects the following fees. The administration fees will be $12.93 per member per month, and that's for the medical and pharmacy services administration. Our specific stop-loss insurance coverage will be $80.69 per member per month, and our aggregate stop-loss insurance coverage will be $2.37 per month. These are fees paid by the county, not incurred at the employee level. So it's respectfully requested that the Board of Commissioners consider approval of the agreements with Blue Cross Blue Shield for fiscal year 21-22 for the administration of our health plan and our aggregate and specific stop-loss insurance coverages so that we can continue providing our health plan benefits to our eligible employees, and authorize the chairman to sign on behalf of the county.
Motion to approve.
Second. Just for clarification, the stop-loss is what we pay per employee per month, but that is if they go over a certain amount of coverage. If their coverage goes over, I believe, $150,000, if it's over $150,000,
$200,000.
then that coverage is what we pay to cover that loss.
Yep, you're exactly right, sir. So our stop-loss coverage, it's a threshold that is set at $200,000. The specific is we pay that per month as an insurance coverage. If claims for one individual go above the $200,000 threshold that's set, then that's when stop-loss kicks in, and we would not be responsible for those claims incurred over $200,000. The aggregate stop-loss is to set a threshold for our entire health plan, and we pay that insurance per month so that if it reaches this certain amount, then that aggregate stop-loss would kick in and we wouldn't be incurring those claims over that amount.
So that, basically, this is just another word for catastrophic care coverage.
That's it, exactly, yes,
I mean,
sir.
that used to be the term for that, but when I first read this, I think I may have called in and talked to you about it, and then I want to make sure that this is something that the county pays, it's not the employee that pays this.
Yes, sir, you've got it exactly.
Any other discussion?
So is there anything we can do to make sure these fees don't increase, like there was no increase this year? Do we incentivize employees to stay healthy? Is that the big focus to prevent the increase, or how do you try to guard against increases?
That's a great question. So we partner every day with our brokers to make sure that we are negotiating with Blue Cross and looking at all angles that we can to keep our claims low. These are the fixed costs, the administration fees. We pay these no matter how high our claims are. So keeping these as low as we can is just a guaranteed reduction. It's only about 10% of our total plan cost, though. So we budget over $11 million for our total health plan. And if we can keep these fixed costs lower, it helps us in the long run because the claims are something that we can't have such control over. So we do things like wellness initiatives. We consolidate services under Blue Cross. They're more inclined to keep our administration fees lower the more we consolidate under them, which is why you see our stop-loss coverage with them as well.
Well, a lot of people see, they say that the pandemic don't bother them, and they're not worried about other people getting it. They're not getting their vaccine, but it does affect them because when a person goes in with COVID-19 and they have to go into ICU, they could be in ICU on a respirator for weeks and weeks at a time, and that would escalate the price. But that affects everybody because it's money coming out of the taxpayer's pocket to pay for those extended medical procedures at the hospital. May not be COVID, but we have, that's what's on the radar right now with the COVID-19
there's kind of that domino effect.
pandemic and epidemic and all. So anyway, any further? All in favor of the motion signify by saying aye.
Aye.
All opposed? Motion carries. Thank you.
Thank you so much.
Next one is Mr. Norm Bryson, Critical Service Agreement, Coastal Carolina Community College.
Good afternoon, Chairman, Vice Chairman, and Commissioners. The agreement that you have before you is with Coastal Carolina Community College for them to allow us to have some of their students to go onto our ambulances and to actually practice their skills and learn about being paramedics and emergency medical technicians and be allowed to be gauged by their preceptors or instructors so that they can work towards their graduation or their credentialing for their next level. This is a process that we have actually been involved with for several years with Coastal Carolina Community College. This agreement is for a 5-year term. We respectfully request the Board of Commissioners consider approving the Memorandum of Understanding between Onslow County EMS and Coastal Carolina Community College, and if approved, authorize the county manager to sign on behalf of the county.
Motion to approve.
Second.
Have a motion and a second. Any discussion?
Yes, Mr. Bryson, does this aid our recruitment of paramedics and EMTs to hire for open positions?
Absolutely it does, sir. It actually gives us a twofold. One, for us, for a chance to look at them to see if we want them to be a part of us, and for them to also see how we operate and work. With Onslow County EMS, we're one of the more advanced systems within the state of North Carolina. Example of that is we're one of the few now. I think there's a second county that's now giving whole blood, but we were the first with some of our practices. But yes, it does allow us to be able to interact with these students and help us with our recruitment of trying to bring them into hiring our vacant positions.
Thank you.
Any further discussion? We have a motion, second. All in favor of the motion signify by saying aye.
Aye.
All opposed? Motion carries. Thank you. I think the next one is yours also, 800 megahertz service agreement.
Yes, sir. This is for the 800 megahertz radio system that Onslow County purchased in 2012. This service agreement actually helps us to maintain the overall system, and it is divided up into several different parts. Part of that service agreement is for a 24/7 monitoring of our system that is done by Motorola to watch for any issues or errors that may come up in the system. Other parts of it is also our service agreement on replacement of parts, giving us at least a guaranteed 24 hours of replacement of parts if we have something that goes down. This actually covers all five of our radio tower sites, as well as equipment that is at the Onslow County EOC and as well at the City of Jacksonville Public Safety Center, because it is all one system that we have. The overall infrastructure is a $12 million item that we're looking to use this to help protect that system. I do have myself as well as Mr. Ray Silence with me here today from the County 911 Center to be able to answer any questions that we may have. We respectfully requesting the Board of Commissioners consider the approval of the maintenance service agreement with Motorola Solutions in the amount of $407,625, and if approved, authorize the chairman to sign the contract amendment on behalf of the county.
Motion to approve.
Second.
Have a motion and a second. I've got a couple of questions, Norm, and maybe both between you and Ray. If we were to look at purchasing the 800 megahertz system today, say we were in the infant stages of purchasing, what would the cost of putting that system in today be? The original, that was back in 2015 and $12 million. I was on the board, Paul was on the board when we voted that to be approved. So what would that, I know things don't stay the same price-wise.
No, sir, things don't stay the same in price-wise. I can tell you that Ray, that is something that Ray and I have, neither one have looked into what would be the cost today to build in that infrastructure, but with the price of steel and items, in that original agreement, what we also did is we built on 3 more radio towers with that original agreement and stood up additional sites, which originally we had the one site at the Onslow County EOC and a second site out at Richlands, and then we also were renting a few tower spaces, which got us completely off of the rental. But to what that price would be today, I do not have an exact price for what it would be if we were looking to purchase and build brand new today.
Wouldn't be $12 million though, would it?
My expectation is it would not be. It would be considerably more than that.
Well, the maintenance agreement, $407,000, that's a big pill. I argued this point every time we had it come before us about it being so much. But that's a big pill to swallow for protecting a $12 million infrastructure. But it's almost like having an insurance policy, so to speak, and I sort of look at it that way, because if you got a product and you want it protected, just like the school system, you have to have insurance to cover damage and loss and to build back. But what if we didn't have a plan? Like, is there any other companies that we could ask for a bid, or is this sole source? Or
basically, you had to be Motorola approved specialists and go through their classes. So really, in our area, wireless, which they're the only Motorola approved repair person that can do repair work, 24-hour maintenance, doing upgrades on our security systems and stuff.
So it's like buying a car from one car manufacturer and trying to go to another car manufacturer to get it covered. That doesn't work.
Sir, I would even say it's even more selective than that, to be perfectly honest with you. You could probably still get someone from a Ford dealership to possibly work on a Chevrolet after it's out of warranty, but it's even more selective than that on who is allowed to operate and work on these systems, because they have to be a direct vendor with Motorola as well and receive those direct parts through the Motorola system. So it's not just there's 3 or 4 other entities out there that we can go to work on this. they're not going to bring in Harris to work on their system, to use an example of another radio system that you have out there today.
How much would you say that they actually do for us that we would have had to pay for if we didn't have this agreement?
I would say the 24/7 monitoring would cost extra. That's where someone in Chicago, they have a monitoring site at their Motorola headquarters, that when any type of alarm is sounded, whether it be, our AC or heating at one of our tower sites reach a certain temperature, they not only do they start a ticket, they call me. With this plan, we're assigned a manager that's service manager, so every time I call in, I don't talk to a different person. I talk to my service manager for whatever problem may be. So you would have to pay for that. And then we pay for advanced replacement of any hardware that might go bad. So if something in the 911 center goes bad to where that radio doesn't work or that tower's down and doesn't work, they guarantee next day delivery, we'll replace it, no extra cost for the product, the labor, or the fees.
So you got a $407,000 service agreement that covers equipment as well, right?
Yes, sir.
For a $12 million system, which would probably cost $26 million today. To me, it's a no-brainer.
And it is our lifeline to the folks for EMS, fire, and law enforcement agencies.
That's where I was fixing to go. It's a lifeline.
Yes, sir.
We have to have it.
That's right.
The one other thing I would like to add, Commissioners, is during Hurricane Florence, the 800 megahertz radio system was the one form of communication that did not fail us throughout the entire storm. While we lost cellular, we lost regular landlines and other methods, the 800 megahertz system was the only thing that we did not lose and kept constant communication.
We can attest to that because you guys handed the commissioners the 800 megahertz walkie-talkies, and they worked during that time. When I couldn't reach some of the commissioners via phone, I could get up with them on the radio. So I know firsthand that that's the case. But, going over this, I'm kind of familiar with service plans and stuff like that, and I just wanted to make sure that this maintenance service agreement includes equipment too, and you already covered that. And again, I'll just reemphasize, you got a $12 million system, which costs probably $26 million now, maybe more, for $400 and something thousand, we're getting the service. How long is this agreement?
Year.
It's 1 year. It's a year-to-year agreement.
It's a year-to-year. So anything goes wrong, any equipment malfunction, they'll replace within 24 hours and all the servicing?
Yes, sir. And this also includes a yearly someone climbing each tower, which if anybody knows how much it costs for somebody to climb a tower and have somebody certified to go, all of our towers are 300 foot tall, except for the one at the EOC, it's 400 foot.
You have to pay me $150,000 to climb that tower.
I'd probably get 2 steps, I'd come back down.
Per
but
foot
yeah.
for me.
You couldn't even make it up the first rung. Nope.
For the record, let the board know and the people that's watching this, what agencies are covered with this. It's not just Onslow County, it's other agencies.
No, it's all agencies in Onslow County. The city of Jacksonville, their police and fire. We do all the municipalities in Onslow County as far as North Topsail PD, Swansboro PD, all the small municipalities like that. Some of our transit system, they use it. And fire department, volunteer fire department, EMS. We do use the system with our surrounding counties like Pender County when we respond automatic aid to them. Camp Lejeune uses it. We have a repeater that we put in the Naval Hospital. So with Camp Lejeune going into the Naval Hospital, they're on our system. They get good service with their radios.
That's what I was going to ask you, if it was integrated with the base, and that's perfect.
Yeah. Camp Lejeune, NCIS, all the Secret Squirrel stuff, they use our radios too. Secret Squirrel.
So when you go to bed at night, you sleep well because you're confident if anything goes wrong, they detect it and they'll get out and fix it. So citizens, everybody knows when they dial 911 that this system is put together to ensure their safety and supreme service in emergency situations.
So the monitoring even covers the temperature control within inside each one of the buildings that's at the tower sites to let us know because basically we're looking at even the radio you carry today is a mini computer that you're walking around with. So as we know, if you have computer systems that are inside rooms, the temperature will get up. If you start to get out of parameters, then it will automatically start doing alerts. Part of that system even sends text messages to Mr. Silence's phones to let him know if the door opens, if the temperature's too high. There are certain parameters that will also make notification for.
Like for the FAA, we have to have tower lights. We have a day light and then a night light for the flying like helicopters, planes, things like that. If that doesn't work right, I get a notification through the alarm monitor.
We have a motion and a second. Any other discussion or questions from the board or any comments? Hearing none, all in favor of the motion signify by saying aye.
Aye.
All opposed? Hearing none, the motion carries unanimously. Thank you.
Thank you, Commissioners.
Section I is Water Restoration Project Stream Debris Removal. Kristen Stewart, Soil and Water Director.
Yes, sir. Good morning, Commissioners. On May 3rd, 2021, the board approved the watershed restoration grant in the amount of $540,069. The funding allows for watershed activities, including cutting and removing of downed trees, broken tree tops, and woody debris that impedes or has potential to impede water flow in the streams and tributaries. Requests for the proposals were issued for the stream debris removal. The county received 7 bids. A copy of the bid tabulation is included with your package. Enterprises G Incorporate is the apparent lower bidder with $299,405. It is respectfully requested that the Board of Commissioners consider awarding the contract to Enterprises G in the amount of $299,405 and authorize the chairman to sign the contract.
A motion?
Motion to approve.
Second.
We have a motion and a second. We had $540,000 and $540,069 approved in the grant. Are we going to be able to use the rest of the money?
No, sir.
We got the bid for $299. Is we going to have money left over? We're going to have to send that money back or what?
We will have to send the money back. So the way, when I spoke to the state representative for the grant, we can add additional streams, but it has to be in the original scope of work. So the process would have to be is I'd have to send additional streams on the scope of work that we currently have to the state. They'd have to prove it. It'd have to come back down. You guys would have to approve it again. Then the bid would have to be resubmitted for contractors to bid on those additional streams.
Do we have a timeline on it?
On the grant, December
Yeah,
2022.
To use the money, do we have a timeline?
December 2022.
We have plenty of time. I hate to send the money back.
Excess right there, man. We can find
I'd hate to send the money back if we can use it, and we got a lot of issues with,
Yes,
you know,
sir.
stream debris and so forth.
There is, I mean, I'm out in the field constantly. There are additional streams that can be added. Unfortunately, the first scope of work that was, I guess, conducted through the previous director, it had EWP funds tied to it. And so when the county went through and said that they didn't want to participate in the EWP program, then we're not allowed to use this set of funding towards the first scope of work. So, so that'll be completely out for this grant, but we can add additional streams. I can sit here and name off 10, 15 right now that we could add additionally to this current scope of work.
And we never know what the bids are going to be anyway, so
Correct.
that's the catch.
It
If
is.
If we knew it was going to cost $500,000, we'd put enough streams in there to cover that, but not knowing, we have to do it piece at a time.
Correct. And if you wanted me to get a list together of additional streams and you all wanted to go back through that process, we definitely can. I can put more than enough that, you know, even the lowest bidder, I would base it off of the current lowest bid and try to fill up more streams, you know, really the necessary to fill out the $500,000 stream bid. And then if the grant can't complete all those streams, then, you know, those last.
You got $540,000 that's got approved, and you get the low bidder of $299. I would try to put as much as I could in there to use that money that was already been approved.
Absolutely.
I would start working on some paperwork for the other streams
Yeah.
Check
now, so we'd be prepared.
Check with the boss about that.
Okay.
Okay, we have a motion and a second. Any further discussion? All in favor of the motion signify by saying aye.
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 All opposed, motion carries. Thank you.
Thank you.
Appointments, Ms. Russell?
Thank you, Mr. Chairman and Commissioners. We do have one appointment for this afternoon or this morning. I'm not sure what time it is right now. It's either this morning or this afternoon. But it is for the Juvenile Crime Prevention Council. As you know, the North Carolina Department of Public Safety partners with juvenile crime prevention councils in every county in our state, and that is to galvanize our community leaders locally and statewide to try to reduce and prevent juvenile crime. Right now, we do have a current vacancy for seat number 23, and this is a commissioner's appointee category. Dr. Dwight Hines has expressed an interest in filling this vacancy. He has submitted his application. It has been certified and is in the clerk's office. We respectfully request that the Board of Commissioners consider appointment of Dr. Dwight Hines, seat number 23, as a commissioner's appointee for a 2-year term for the Juvenile Crime Prevention Council, expiring on June 30th, 2023.
Motion?
So moved.
Second.
Motion and a second. All in favor of the motion signify by saying aye.
Aye.
Motion carries. Thank you. We are now at consent agenda. We had nothing moved from the consent agenda to item 6, so we are now moving to item 7, Ms. Russell's comments.
Thank you so much, and I do have some things to share this morning. First, I will respond. We appreciate all that Christian Stewart has done as our Soil and Water Director. I've spoken with a couple of you. We did hear from Christian last week. She has put in her notice of resignation, but we will try to work with her and other staff. It is very sparsely staffed, Soil and Water in Onslow County, to try to get some more of this paperwork together to save these grant funds. But I wanted you to be aware of that. In addition, we have some bad news on the COVID front. I know that no one wants to hear this, but we still have to say it. Of course, it's our duty to say it as the providers of public health in this county, and because we don't want to see citizens pass away. We have had 499 new cases diagnosed since last Monday. At least 76 of these, and probably there's been more since I got these statistics, just came in this morning. Our internal count right now is 19,210. We have cleared 18,417 cases. We have had 2 new deaths in the last couple of days. We are up to 162 fatalities. Both of these individuals were over 65 years of age. They did have underlying conditions. Last Monday, we were at 9.7% positive here in Onslow County. This morning, we're at 12% positive. Statewide, last Monday, it was 8.6% positive, and the state is at 9.5% positive today. We are seeing a dramatic local impact this morning. I've already been on the phone this morning with Norman Bryson, with Colonel Thomas, as we serve the public in our vital roles as first responders in both public safety and emergency services. Unfortunately, these are our staff members who first show exposure when we have an uptick, and it is impacting our ability to serve this morning. In our EMS department, we are currently seeing more than 10 folks that have tested positive. We are down almost 30 people in EMS this morning. It is serious enough that I have given Mr. Bryson clearance. We have requested an ambulance strike team from the state of North Carolina, EOC, so that North Carolina Emergency Management, to come assist us as we've assisted others in the past to make sure that we're able to serve the needs of Onslow County citizens while we allow our paramedics and EMTs to get well from these COVID infections. It is also impacting our sheriff's office. It's not as dramatic at this point as we're seeing at EMS, but they are beginning to have to really pay attention to their numbers. And these are the folks that we send out there every day who are in contact with the public. And we ask a lot of these folks, and we've got to try to keep them safe. We're going to be also looking at our social services folks who are out in direct contact. We also tend to see their numbers uptick. I also reached out to Dr. Penny Burlingham-Dill this morning and also to Marty Somerville at Naval Hospital. This morning at Onslow Memorial Hospital, they have 19 inpatient patients who are positive for COVID-19, and she has 5 in ICU this morning, and that has started going up. The Naval Hospital said that they had to reopen their COVID ICU last week. They had 5. This morning, they have 3 in ICU. They've had 182 positive cases in the last week in Naval Hospital. Mr. Somerville told me this is the 12th highest week of cases they've had out of the past 18 months. So they are also seeing significant incidents. We have also had at the Naval Hospital an unvaccinated medical professional who passed away. It is so important right now that people get vaccinations. I know people are afraid of the vaccination. Many of us didn't like the way we felt after the vaccination, but the reality here is that 99% of the deaths are unvaccinated people. Currently, fully vaccinated people only account for 0.01% of fatalities due to COVID-19. So even though you may get sick and you may not feel great, getting that vaccination really makes a big difference, and it could really help us protect our employees who are coming out to save lives. We do have free walk-in vaccinations available at the Onslow County Health Department, and that's at 612 College Street. We have all 3 brands. You can walk in, get your vaccination. It's easy, it's fast. We also have most of our medical providers in our city and county that will provide a vaccination for you if you ask for it. And we do encourage you, if you've been waiting to see how it's going to go ahead and do this for the greater community so that we can move on with our lives and not be under this kind of threat again, because it is now again affecting our hospitals. And that's all I have this morning, unless you have questions for me. And I just appreciate all that all of you are doing and for allowing me to continue to serve in this role.
Thank you,
Sharon,
Ms.
what
Russell.
was the increase in patients as this week as compared to last week? You said it was 19 this week and 5 ICU. Do you have what last week's was?
I did not get that statistic from Dr. Penny, but I can reach out to her and follow up with you on that, Commissioner Price.
Thank you.
Sharon, one
Yes.
day early last week, I know they had 4. So
Okay.
it's been just a little over a week that there were 4 in the hospital at Onslow Memorial.
Thank you so much. Did you want to add anything else, Sherry? I know that Chrissy is actually dealing with some public health emergencies right now related to this. So I know that Sherry's been in close contact with her. Is there anything else I left out?
We just want to remind folks, as Sharon said, we have all of the vaccines available. In addition, we're continuing to recommend that our citizens follow the recommendations of the CDC in terms of the guidance they're providing. They have more up-to-date and up-to-the-minute knowledge of exactly what's going on with the virus and the different variants. So their information is really the best. And it's one of the reasons that on our website we link you to their stuff so that we can keep abreast of all of the most current data and the current recommendations. So watch those recommendations on the CDC's website and follow them.
Okay, thank you. We'll start with Commissioner comments. I'll start with Commissioner Knapp right here next to me on my left.
As you can tell by what Ms. Russell said about the COVID-19 updates and stuff like that, I've been tracking the updates for over a year, and this is a big increase, and it concerns me. Now, I'm not going to sit here and tell you that you have to get vaccinated. That's your right, especially those people out in Onslow County. It's your right to make your decision, and I respect that. As far as I'm concerned, I got vaccinated to protect myself, my family, and others. And when you hear the statistics of 99% of the people that are vaccinated are not affected by this in terms of what, 0.1% or 1%, something like that?
That's correct. The fatalities are 0.01% for those who are vaccinated.
To me, that's alarming. And now we've got the Delta variant. Now we have another variant that's a branch off of the Delta variant. I don't know how this thing's how it's gonna progress. We got serious about it a year and a half ago. We need to still stay serious about it because there are people out there that are not even really caring. you know, that's not going to help, it's not going to affect them, I'm going to let my immune system take over. Well, you know, that's fine, that's your choice, and I respect that, but you have to think of others as well, okay? And your immune system may not be that strong. Even people that are with immune depressed systems are getting the shot, and it's helping them. And I kind of look at it this way, you know, do I want to take the chance of contracting COVID-19 or the Delta variant, or do I want to suffer the consequences of the side effects? And I tell you right now, the side effects are minimal compared to what I've heard and seen from personal friends that are in the hospital with COVID-19. So we need to continue to do our best as citizens. We need to continue to monitor our proper hygiene protocols. I mean, if you want to wear a mask, that's fine. I know some people who've been vaccinated continue to wear their masks to protect others, just in case, because this is serious. We went down, the spike went down, and we thought we're getting out of the woods on this one, and all of a sudden, you know, it comes right back rearing its head, and now we're seeing a big influx. And that concerns me as a commissioner and as a person. It concerns me. There are people that are just not taking this seriously, and they need to. Again, it's your right to get vaccinated, but like Sherry said, I would take the recommendations of the CDC and do that. You know, do what you feel is right. But again, it's your choice. It's your choice. But just stay safe out there, folks. And I'm really surprised because I hadn't seen the update this morning. We had 409. That's 500 people in the last week. And the other thing that I've been noticing too with COVID-19, it's not affecting the elderly anymore. If you haven't noticed and you haven't watched the Delta variant, it's affecting athletes in Tokyo, for example. Athletes, young athletes, healthy athletes. Kids are being affected by COVID-19 and the Delta variant. So it's not restricted as it was before to the elderly people, you know, in their 60s or above, which I'm a part of that group. So there's that to consider. We don't know how far this is going to go, and hopefully we can get it under control. But I just pray all of y'all stay safe, do what you feel is right, and stay healthy as you can. Thank you.
Commissioner Price.
Thank everyone for coming out this morning, and have a good afternoon, and we will see you next time.
Commissioner Scott.
I just want to wish everybody a safe week. Got National Night Out tomorrow night. Now be safe. If you're not vaccinated, please consider doing it. And be safe, and God bless. Thank you.
Thank you. Commissioner Bennett.
Thank you, Mr. Chairman. Thank you, Salem Clark. Look forward to the new tourist brochure. And I wanted to congratulate the new Board of Elections, Mike Morgan, Laura Deptola, John Moore, Stephanie Moser, and Marcia Wright were sworn in a couple of weeks ago, our Board of Elections. It's going to be their responsibility to make sure we have a fair and safe election next year, and look forward to working with them. Thank you.
Thank you. Commissioner Buchanan.
You know, this is interesting with this COVID-19, and Robin's been really preaching this for many, many meetings, and I totally agree with him, but I'm fixed to say something that's probably going to upset some people. I think we have a problem, and the problem is in our public safety officers. If they can't respond, gentlemen and ladies, what are we going to do for our community? Right now, we're looking for some assistance for our paramedics outside Onslow County. If this continues, what are we going to do? And it's almost like what I'm going to tell you needs to happen. I'm only one commissioner, and you're probably going to get upset. I think our public safety people need to be vaccinated, and we're going to have to get them vaccinated. I don't know what we're going to be able to do, and I don't know how the board feels about that. But if they can't respond, gentlemen and ladies, what are we going to do for our public? They've got to respond to the scene. If we're 30 short paramedics, what are we going to do? We need to think of the future of our citizens, and everybody stay safe, but get vaccinated, please. Thank you.
Commissioner Foster, Vice Chairman.
Appreciate everybody showing up today. We'll keep getting the COVID-19 updates. Delta variant, I think Commissioner Knapp said there's another one that's appeared, and my prediction, there'll probably be another one. That's what viruses do. And it's going to continue down the line until eventually it does its thing. But take care of yourself, make the choices that you feel is best for you, and keep your heads up and keep plugging along, and we'll win this. Thank you.
Thank you, sir. I want to comment real briefly about the hospital stays, people that's in the hospital. Just think about it. If you get in a traffic accident out here and you had to go to the hospital and this all filled up with COVID-19 patients, where are you going to go? So people said, don't worry about the COVID-19, it's just a minor virus and we'll get over it.
Say what I said,
But if they fill that up, if the hospital gets filled up, not to mention what Commissioner Buchanan was talking about, our transport. If we can't transport them and we can't, and even if we could and you get to the hospital, nowhere for you to go, what's gonna happen then? So it affects everybody. I would, on the vaccine, I would say this. If you have a doctor that you trust, that you go to every day to get your ailments taken care of, go talk to your doctor. Don't listen to me, don't listen to Commissioner Knapp, don't listen to Paul or nobody else up here. Go to your doctor and let the doctor tell you or recommend to you if you need to get the vaccine or not. If you trust your doctor, I would take your doctor's advice. I think the medical profession is more in a position to tell you what you need to do than anybody else. And you hear all the time say, well, I'm not going to take that vaccine. I've got relatives that won't take it. They just don't want to take it. And they got various reasons why they don't, and I respect that. But when it taxes all the other people that has to go out here to the sheriff's office and our EMS and our volunteer firemen responding to a fire call, and then they get sick, who's going to respond? Who's going? And they, by the CDC, if they test positive, they're going to have to be quarantined. And if they quarantine, they can't go anywhere. So that really kills the workforce, theoretically. I'm not going to go over the number of cases that were reported, but that's extremely concerning with the number of cases in 7 days. I think 7 days, 500 new cases. And I read a post from the doctor that runs Star Med, and over the weekend, the ones they tested just Saturday, 63% of the ones they tested Saturday tested positive for the virus. That was 60, I don't know how many people that was overall that was tested, but that's still a big percentage of the people that come forward and were tested. So that's really ramping up. The vaccine don't prevent you from getting it. You can still get it even if you've had the vaccine, according to what I've been told, but the vaccine keeps you from being hospitalized and it keeps you from dying from it. And I'd rather, like Commissioner Knapp, I'd rather take those chances than I had having to weather that storm of the virus. But other than that, I appreciate everybody being here today. We are in a position now to look at the virus and which way it's going to take us. So other than that, I'd entertain a motion to adjourn.
So moved.
All in favor?
Aye.
We are adjourned. Thank you for coming.